Mina Paul Kaikai, National Coordinator, Service Users and Family Members Association, an association mainly for discharge or discharging patients, and all the one that we don't already discharge, we get the live by experience, and service providers. We together with SUFMA, they try for gain access to mental health services throughout the country. Well, one big success story is that government don't try to get a mental health unit now inside the Ministry of Health and Sanitation. So we've used them with challenges, we help bring them forward before the ministry through the Directorate of Mental Health. And secondly, most of the members there where they sick, they now get recovery as long as then they access mental health facilities as early as possible.
Serious challenges.
The present serious challenge is how we will able to engage the one that we don't already discharge from hospital then, how we will put them into livelihood skills scheme, also that we will put them as self-help groups so that then will be ambassadors then at the various communities. For sure, say this long abandoned sickness, what then they call mental illness, can now well, and the person who is sick will now enter in community proud as he is and for go back and do his social and occupational skills where it be done learn already, and it will be of value to himself and to the community where it is. We don't tell the participants and say it is really amazing and very much exciting for see such members then from various MDAs, ministries, departments and agencies for can know exactly who done a SUFMA and what thing I would need them. Would they try for ask government, for let government first of all make we enter communities, all communities then in the country and the 16 districts then, and help with logistics. At least if in our mobility self, we go gladly. And the other one, office space. Make government give you office space so that we will implement for social welfare, because most of the problems they're more social than medical. And at least for medical, if we discharge them, let them not abandon them again, let them go back to their old problems then. Now get a rehab center in every district so that they will become a laboratory for human capital development.
Alright, so right now office space is ID?
Office space right now is Kuntoro approved school. And approved school is owned by social welfare government. And even though we pay for them, we they still ask government for help for so that we will be able to capacitate the office and capacitate the staff, and by extension the family members. We also then the other psychological first aiders, because now the first people then that will be able to detect the sickness for the attention of medical health and mental health service. It will very much be a serious challenge. Government they put in for essential drugs. So we advocacy too has always been do government add psychotropic drugs then what they did directly with the mental health and mental well-being of the patients then. Because at the end of the day, the essential drugs they're more there for physical, like malaria, typhoid, tuberculosis, and these are some of we believe then. As long as these other diseases can be cured, then therefore mental health or mental illness, mental health conditions are very much also treatable as long as we access the mental health facility in time. Anybody who want to locate we now, they will locate you through a new office when a approved school building, the Ministry of Social Welfare, Kuntoro, Yokupa. And for easy access to we implement for Touching Minds Raising Dignity project, which is supervised by Handicap International. So for easy access, you can also access us through Humanity and Inclusion Office in Lumley or the Touching Minds Raising Dignity Secretariat.
Okay, so phone number?
The phone number is 079 377 369 080 303 544 078 70 40 99.
Of course, we're not going to do this interview if you're not telling me about the good support so far with Handicap International. Why don't they do now?
First of all, we're very much glad for let Handicap International look among all other sectors in the country and pick up SUFMA, Service Users and Family Members Association. Before now, we not be a charitable organization. Before now, we've been depend on the mental health coalition. But since they come into our life, we now they experience autonomy and independence. And we get a lot of capacity building training in leadership, in financial management, And even with the outbreak of Ebola and COVID, then teach we resilience skills, how we were able to withstand the pressure and the stigma around Ebola and COVID. And not only that, then they also expose you to international conferences where they make with the see other people, other countries then, and other service users and family members association.